Good morning, sir. My name is Sharbini. I will be a doctor assisting today. So first of all, can I know how old are you?
I'm 60 years old.
60 years old. So what do you do for a living?
I'm a welder.
Welder. Okay. Where do you live in Russia?
I live in Lanina Street in Kursk.
Okay. Can you tell me more about your complaints today?
I have numbness and coldness in my fingers.
Fingers. Which arm?
In my left arm.
Left arm. Okay. I'll ask you about more questions. Do you have bruises?
No bruises.
No bruises. Gum bleeding?
No.
Wounds?
No wounds.
Any nosebleeds?
No.
Okay. Okay, like to ask, when did the pain exactly started?
Around 3 days ago.
3 days ago. So, can you tell me more about your pain, the severity of your pain?
At first it was mild, but it got really intense later on.
Later on, okay. So it actually grew gradually,
Yes,
right?
it grew.
So, did you go to the doctor when you had
No,
pain?
no, I
Okay.
didn't.
So, did you take any medicine?
No medicine.
No medicine. So, when did you actually decide to go to the doctor?
When the pain got too bad, I knew I had to go to the doctor.
Okay. So, I'd like to ask more about your past history.
Yeah, sure.
And then, do you have gastric ulcer?
No.
Any allergies?
No allergies.
Have you had any blood transfusion?
No.
Smoking?
No.
Any alcohol or drug abuse?
No.
Family history, like family histories?
No.
Any family histories? No. Okay. Diabetes mellitus?
No.
Any operation recently you had?
No.
Okay. TB?
No.
Stroke?
No. That's true.
Myocardial infarction?
No.
Any rheumatic disease or microstenosis?
Yes.
Have you taken any medicine?
No.
So hi sir, I've come back to you with all the complaints that you have given to me. It looks like you have a very high hemostatic system, and it looks like you're not consuming any medication, like anticoagulants for your rheumatic disease.
Yes.
So these are the reasons why you are having some numbness and coldness on your fingers, because you're not consuming any anticoagulants. So when you don't consume any anticoagulants, the risk of you having blood clot is very high. So blood clot can lead to thromboembolism. So thromboembolism is a term that can actually risk your life.
Okay.
So you should start consuming anticoagulants.
Okay.
So for further treatment, we'll refer you to other doctors. So thank you.
Okay, thank you.
Hello, Mr. Welder. I'm Dr. Navi. Today I'll be doing objective examination on you. Do you know where you are now?
Yes, in the hospital.
Okay. The patient is consciously alert, so I would give 50 points in the Glasgow Coma scale. And but the patient is in a supported position since he has severe pain on the left hand. The patient is 60 years old, but then he looks older than his actual age. Okay, so let me examine you physically. Okay, so okay, the size of the head is normal, and the patient's ears are normal, and then the patient's sclera is white, it's normal. Can you open your mouth? Okay, the patient's mucous membrane looks good, and the lips looks good, and the patient's neck is fine. Okay, Mr. Welder, can you stretch your hand forward? Slowly, because I'm going to take it over. I want it again. Okay, thank you. The patient's fingers looks fine. There's no clubbing and there's no tobacco staining. And the patient's skin is hydrated and there's no sign of edema. Okay, now I'd like to check your temperature. Can you open your mouth? Okay. The patient's temperature is 36.5. The patient's temperature is normal. So now I'd like to proceed to respiratory system. Okay, now I'm going to examine the respiratory system of the patient. Okay, Mr. Welder, can you breathe in and breathe out normally? Okay, can start. Okay, the patient's respiration rate is 16, which is normal. First, you have to undress the patient in the real case scenario. Okay, so the patient's chest looks normal, it's normal swelling, and there's no scarring, there's no swelling, and there's no sign of incisions. Mr. Welder, could you please turn on? And the posterior part, there's no signs of scarring, there's no swelling, and there's no redness. Okay, can you please turn on here? Okay, now I'm gonna palpate the respiratory system. Okay. Okay. Can you breathe and breathe out normally? Okay. Could you please turn? Okay. Can you breathe and breathe out normally? Okay, thank you. Okay. Now I'm gonna percuss the patient, and during palpation there's no anything abnormal. Everything looks fine. Okay, so now I'm gonna continue with percussion. Okay. Okay. So please turn. Okay, thank you. Could you please turn again? Everything looks fine during percussion. I'm gonna auscultate. Can you breathe in, breathe out? Okay. Oops, sorry. Could you please turn over? Thank you. The patient's respiratory system is perfect. There's no any abnormality. Okay, now I'm going to examine the patient's GIT system. Okay. Okay, there's no hernia, there's no swelling, there's no sign of any abnormalities. Okay, now I'm going to palpate. First, I'm going to do superficial palpation. Mr. Weather, please do tell me if you feel any pain. Okay, now I'm going to do the deep palpation. Okay, now I'm going to percuss. Okay, now I'm going to auscultate. Okay. Okay, there's no any abnormalities with the patient's GIT system. It's totally fine. Now I'm going to examine the patient's genitourinary system. There's no any hyperemia, there's no any swelling, there's no any hernia. Okay, I'm going to palpation. Do you feel any pain, Mr. Weather? Okay. Can you please? Okay. Okay. Thank you. The patient's genitourinary system is normal. There is no any abnormalities. Okay. Now I'm gonna examine the cardiovascular system of the patient. Okay, Mr. Weldon, can you give me your hands to check the pulse and this hand? Alright, thank you. Okay, there's no pulse felt on the left hand and there's pulse on the right hand. The pulse on the right hand is 60. Okay, now I'm gonna check Mr. Welder's blood pressure. Mr. Welder, can you give me your right hand? Thank you. So the patient's blood pressure is normal. It's 120/80. Okay, Mr. Madam, could you please lie on? Okay, now I'm going to inspect the patient's cardiovascular system. Okay, there's no sign of scarring or sign of swelling and hyperemia. Okay, now I'm going to palpate the patient's cardiovascular system to check for apex beat. Okay, there's beat present and the apex beat is also present. Now I'm going to percuss the patient. Okay, so far it looks fine. Now I'm going to auscultate. Can you please breathe in and breathe out normally? So during auscultation, I heard a murmur sound and a harsh sound during systolic and the soft sound during diastolic.
Hi, I am going to check the local status on this patient. Hello, my name is Dr. Mira. Can I do some examination on you? Is that okay? Firstly, I will do the inspection on both of his hands. As you can see from the inspection, the patient has normal color on the right hand, while the left hand has cyanotic discoloration of skin, together with the nail, fingers, all over the arm until forearm. So the patient has the cyanotic discoloration of skin at the left side of his hand. Now I am going to squeeze on your fingertips to check the capillary refilling time for both of your hands. For the right hand, the patient has capillary refilling time within seconds, while the left hand shows that the patient has capillary refilling times more than 3 seconds. Now I am going to check the temperature for both of the hands. Temperature of the hand on the left side is cooler than the right side. Can you please turn your hand over? Thank you. So as you can see that the patient has no scars and no tissue loss for both of his hands. Okay, now I'm going to squeeze again. So the results are still the same. The patient has a lower capillary refilling time on the left side rather than the right side. Right now, I am going to take pulse on the radial and ulnar side. Okay, you just have to relax. And I will feel right here first. The radial artery on the left side is absent while the right side is present. The ulnar artery on the left side is absent while the right side is present. So the patient has the normal rate and rhythm at the right side while the left side is low to absent of pulse. So the patient has pulse deficit because the pulse does not come at the same time. So right now I will check the brachial side. The pulse on the left side is absent. The pulse on the right side is present. Right now I am going to check your blood pressure. Firstly without the stethoscope, okay? Okay, now I am going to do with the stethoscope on the left side first, okay? Now I will do the same thing on the right side. So, based on the blood pressure that I took, you have the absence of the blood pressure on the left arm because I cannot sense any pulse, while the right hand, I can sense the pulse and you have the normal blood pressure which is 120. So this may be because you have the arterial blockage somewhere in your left arm which make it difficult to find any pulse, okay? So now I will check the numbness both your side. So do you feel numbness on your right or your left side? Left side?
Yes.
Yes. Okay. Can you please move both of your arm higher?
I cannot get there.
Okay. Right now I am going to do examination on other parts of your body. So can you please lay down for me?
Yes.
Okay. Okay, thank you. So right now I will going to inspect your body so you don't have any problem on your body area. Okay, so can you please lean your head to the other side? I want to check your neck.
Yes.
Okay, the neck has normal condition. So right now I will check for your carotid artery on the left side. It is present. And can you please lean on the other side? Carotid artery on the right side is also present. Okay, now I'm going to check the subclavian artery. On the left side is present. On the right side, subclavian artery is also present. So right now I'm going to auscultate on the carotid and the subclavian artery. Left carotid artery, right carotid artery, left subclavian artery, right subclavian artery. There's no bruits heard on the carotid and subclavian artery. Now I am going to check your abdominal aorta pulse. The abdominal aorta pulse is present. I'm also going to auscultate that side. There's no bruits heard on the abdominal aorta. Right now I am going to check the femoral artery on the left side and on the right side. So both femoral artery on the left and the right side is present. No bruits heard on the left and the right side of the femoral artery. For the examination on the leg, I will inspect first. So the patient has normal condition on both of the leg. There are no varicose vein present on both of the leg too. Now I am going to check the temperature. Temperature is normal for both of the sides. Now I am going to find the popliteal pulse for both of the leg. The popliteal pulse for both of the leg is present. There is also no bruises or ulcers present on the back of the patient's foot, and there's no problem also between the toes. Now I am going to check the posterior tibial artery. The posterior tibial artery for both of the leg are present. I am going to check the dorsalis pedis artery. Left and the right side of leg has present dorsalis pedis artery. Right now, I am going to check the blood pressure on the patient's leg. The patient has normal blood pressure on the left leg at 120. Right now, I will check blood pressure for the opposite side. The patient also have the normal blood pressure on the right leg at 120. Now I will show how ankle brachial index will be performed. The ankle brachial index is 0 as it cannot detect value on the left forearm. From the examination on the local status on this patient, we can conclude that the patient has peripheral arterial blockage on the left side of his arm. This is due to there's no pulse present, it is cooler than the right side, there's no blood pressure can be detected also, there's also numbness and sensitivity is not present. The patient also has difficulty in movement on his left arm. The further investigation that will be needed for the patient, such as arteriogram, should be conducted in instrumental diagnosis later. From our examination at this moment, we can say that you have problem hemostatic system. So the condition that we have obtained right now are the results from alteration of your hemostatic system. In your condition, there is a condition is called as coagulation happen, and this will activate the formation of the thrombus, which is the blood clot, especially on the left atrium of your heart. So this is your heart. Okay, as I mentioned before, it divides into 4 sections. Okay, so your problem root at the left atrium because you have a problem with rheumatic disease before. So there must be have a coagulation happen on the left atrium, which will then flow to the left ventricle, and then from the left ventricle to the aorta at here at the upper side, and then flow to the left subclavian artery, okay, which then go to the left axillary artery, then from the axillary artery to the brachial artery, which why there is a blockage on the brachial artery here. So this is why I cannot find your pulse on the radial and ulnar side of your hand, because the brachial artery will be divided into radial and ulnar artery. So if there's a problem at the brachial artery, so the radial and ulnar artery also will be a problem. Even without instrumental tests that will be conducted to you later, I am sure about 90% suspect that the blood clot has been migrated from your left atrium of the heart into the systemic circulation and blocked at the brachial artery, and this is causing the sign of ischemia.
What is leukemia, doctor?
Okay, ischemia is inadequate blood supply to the part of your body. So in your condition, the blood cannot supply on the left arm and radiate to the left hand. You actually must have been followed in prescribing some medicine and must have been followed by cardiologists as you have rheumatic disease before. So I am sure that you have been prescribed with anticoagulants, but I cannot understand why you didn't take it.
I think I forgot, doctor.
Your situation causing that you have damage of the valves from the rheumatic disease. So by not taking anticoagulant drugs that has been prescribed for you or not, I am not sure, but it's supposed to be prescribed for you, which results in the blockage of the peripheral arteries, but in your situation, it is on the brachial artery. As for now, we cannot give any further planned treatment for you because we need to do further investigation in instrumental and lab diagnosis for you later. You need to approximately wait about 30 minutes to get the result, and after we gather all the lab and instrumental diagnosis about you later, we will then make a final diagnosis together with the plan of the treatment that you will receive later. Okay, now you will meet another doctor that will assist you on the lab and instrumental diagnosis. Do you have any question?
No, thank you.
The complete blood count test, the patient's results were all in normal values, meaning there is no evidence of hemostatic system suppression. This is because the patient did not consume any blood thinners, although it was indicated. The doctor will now explain to the patient about the findings on instrumental tests. On the X-ray, we could see that the shape of the heart has moved to the left side as there is problems with the mitral valve and the left side of the heart needs to work harder to pump blood. Hence, the heart has a saddle shape. On arteriogram, we could see that there is narrowing of the blood vessels over here and here, showing that there is brachial artery thrombosis. On CT scan of the heart, we could see that there is thickening of the mitral valve that causes abnormal blood flow from the left atrium to the left ventricle. Using Doppler ultrasound on the brachial artery, we could see that there is narrowing of the artery over here, which further proves that there is brachial artery thrombosis.
Good evening, doctor. What is the report? Good evening. You have thromboembolism at your left brachial artery due to rheumatic disease, and it results in scarring of heart valves and cause damage at the site of endothelium. This damage leads to clot formation in the left atrium, and the clot formation and hemostatic system activation is triggered due to bacterial damage of the valve endothelium. Due to this, the clot moves away and flows to the brachial artery. This blocks the flow of blood, and due to this you have numbness and coldness of the left arm. As there is no sufficient blood supply there, due to embolism, the clot grows and don't flow because the flow of blood is poor. You also have blood hypercoagulability, damage to vessel wall, and change in blood flow. Okay? Final diagnosis and treatment plan. The patient is suffering from rheumatic disease, stenosis of mitral valve, thromboembolism of left heart, and acute atrial ischemia of left hand, second degree. The treatment is medical and surgery if needed. Activity of hemostatic system is high, thromboembolic complications risk is high, there is no risk of hemorrhagic complications. All three factors of Virchow's triad, that is high coagulability, change of vascular wall, and slow blood flow is seen. The activity of hemostatic system is high and there is a high risk of thromboembolic complications. Do you have any other question? No, thanks, doctor. Okay, any other thing I will update you. From Virchow's triad, 3 out of 3 triads are affected. If any of the mentioned features are not optimal, the subsequent flow dynamics may result in abnormal flow, thrombosis, and thromboembolic and potentially neurologic or other end ischemic complications. Hence, we can make a conclusion that there will be a high activity of hemostatic system that can cause thromboembolic complication to the patient.
For the medical therapy of the patient, anticoagulants such as heparin and aspirin are administered to the patient, as well as vasodilators such as verapamil intravenously. At the same time, we have also monitored the patient's activated partial thromboplastin time, international normalized ratio, platelet count, and bleeding time for 3 hours to determine the efficacy of therapy. After 3 hours, the local status of the patient is re-examined to determine the efficacy of therapy. Hello sir, may I ask how is your condition after the medical therapy?
I feel a lot worse than before.
Alright, sir. On examination of the peripheral vascular system, we discovered that there is cyanosis of the left arm, hand, and nails. When palpating the radial artery, the pulse and the pulse volume on the radial artery of the patient is absent.
Action.
Hello sir, now I'm going to palpate your left arm and I need you to tell me if you feel anything, alright? Do you feel anything, sir?
Yes, it's very intense pain. There's also a combination of numbness and loss of sensation.
Alright sir. Alright sir, now I will need you to lift your left arm forward. Can you do that?
No doubt. I don't think I can.
Alright. Alright sir, now I'm going to perform the capillary refill test. Is that okay with you?
Yes.
We measured the capillary refill time of the patient and found that it was more than 3 seconds. We also measured the regional blood pressure on the left arm and found out that it was absent as well. The ankle brachial index cannot be measured because the brachial artery pulse is absent. Based on the re-examination of the local status of the patient, we can conclude that the patient's condition have become worse. Hello sir, after the examination of your local status, your condition have deteriorated and medical therapy was ineffective. Therefore, you should be admitted into the surgical department and undergo emergency thrombectomy to restore blood flow to your left arm. Is that okay with you? Alright. After admission into the surgical department, the patient is placed on NPO. A nasogastric tube is placed on the patient and an intravenous cubital access is made. Medical therapy such as administration of heparin, aspirin, and verapamil is still continued intravenously in the surgical department. Antibiotics such as benzathine benzyl penicillin and penicillin V or erythromycin is administered to the patient for secondary prevention of rheumatic fever.
Hello, I'm Dr. Suzanne. I would like to talk you through the surgery so you know how the procedure will be like. In short, you will make a cut on the area above your blood clot, open up the vessels and remove the clot. A balloon will be inserted together with a tube, which is called a catheter, into the blood vessel to remove any remaining clots. A stent will also be placed into the blood vessel to help keep it open. After that, we will close and repair the blood vessel. The incision will be closed and bandaged. This procedure will help to restore blood flow, and it is called balloon angiography with stent.
Okay.
On top of that, we will be using local anesthesia as this procedure can be tolerated with it. At the same time, we could minimize the risk of general anesthesia and the side effects that it comes with. The risk of the surgery is moderate, however there is risk of thromboembolic, where the blood clot breaks loose and blocks another vessel, and also risk of bleeding complications can occur.
What are the chances or success rate of this procedure?
Without the surgery, the chances of survival is 15%, as it is a dangerous condition, but with this surgery it is increased greatly to 85% chance. Do you have any other questions you would like to ask? Feel free to do so.
I think I have enough information on the procedure.
Okay, if you have understood the procedure and the risk that it comes with it, and if you agree with it, then you may sign this consent form so we can proceed with the surgery.
I'm Dr. Shirin and I'm here to check you. So how you are feeling now?
Okay, doctor.
Okay. So I'm here to going to check you the local status. Is it okay for you?
Okay, doctor.
Okay. So first, so on your left arm, the color is turning back to normal. Okay. And so now I'm checking your pulse. Pulse rate is normal and pace volume is also normal and normal rhythm. Can you do any movement? Okay, so movement is present. Okay. Can you feel any sensation?
Yes, doctor.
Okay. And tissue loss is present at the site of surgery and numbness is absent. So, do you feel any pain?
No, doctor.
Okay. So now I'm going to check your blood pressure. I'm going to check your capillary refilling time. So, in which I am pressing your finger.
I'm lying to my position. I'm going to check the brachial artery. I will try to locate the brachial artery at the antecubital fossa. So here we have the brachial artery. Now I will show you the waveform of the right brachial artery. We have a nice triphasic waveform of the right brachial artery with the maximum velocity is 277. We are going to inflate the blood pressure cuff. Okay, start now. Keep inflate. We keep inflate until no longer we have signal. Now we deflate slowly. We have the first signal at 140 millimeter mercury. I will document that. Now we move to the ankle and we put our blood pressure at the lower leg. And here we have two arteries, the posterior tibial artery and the dorsalis vitas artery. We are going to take the waveform for both of them. And then the maximum measurement you are going to divide it over the arm blood pressure. Okay, so we try to locate the posterior tibial artery behind to the ankle. Now we'll apply the pulse wave. We have nice triphasic waveform. I will start to inflate the blood pressure curve. Until no more longer double signal. Now we'll deflate slowly. Slowly. At 150 we detect first signal. So the right.
For post-operative medicine, we will give the patient heparin, which is anticoagulant injections, for 2 ml at the cubital vein at 1:35 p.m. And also we will give aspirin, which is anti-platelets injection intravenously at cubital vein, 2 ml also. And we will repeat the same at 3 p.m. for heparin, and also at 9 p.m. for heparin. And also at 12 a.m. we will give the patient vasodilators, which is Verapam, and then 2 ml at cubital vein intravenously. And so the patient needs this blood thinners is because we need to prevent the blood clots to happen. And then this will continue for 1 until 5 days. So from day 5 post-operative, we will change the heparin to anticoagulants, the oral anticoagulants, and then you will have to make sure the patient will continue their follow-up with cardiologists. And then for the oral anticoagulants, we will give you vasodilators, which is verapamil 180 milligrams. The patient will have to take 1 tablet before bed at night. And then we will give also antiplatelet drugs, which is aspirin 160 milligrams. You will have to take 1 tablet after breakfast. And then we will give also anticoagulant drug, which is warfarin, initially 5 to 10 milligrams for the first 1 or 2 days. And then we will give 2 or 10 milligrams daily. This one you should take 1 tablet in the evening.